This is Women Road Warriors with Shelley Johnson and Kathy Tuccaro. From the corporate office to the cab of a truck, they're here to inspire and empower women in all professions. So gear down, sit back, and enjoy.
Welcome. We're an award-winning show dedicated to empowering women in every profession through inspiring stories and expert insights. No topics off limits on our show. We power women on the road to success with expert and celebrity interviews and information you need. I'm Shelley.
And I'm Kathy.
Stem cell therapy is all the rage today, but there's still a great deal of confusion about it. What many people may not know is to reap the benefits of this regenerative treatment, invasive injections are not necessary. Dr. Tommy Rhee is a pioneer in regenerative medicine and promotes non-invasive stem cell therapy. His expertise spans many years. He's treated pro athletes like the Tampa Bay Buccaneers, UCLA athletes, and even the U.S. Navy. His latest book, The Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy, talks about how topical stem cell applications are reshaping healing and longevity. Dr. Rhee has been a practicing chiropractor since 2006 and served as the official team chiropractor of the Tampa Bay Buccaneers for 3 years. He developed RheeGen, which is a safer stem cell alternative that doesn't use live cells or invasive procedures. Dr. Rhee has pioneered and was the first master provider of ART, or active release techniques, in 2008, the first to bring exercise with oxygen therapy, or EWOT, in 2012, WholeBody Cryotherapy in 2015, Shockwave therapy in 2016, and CryoFox in 2018. All of these regenerative techniques can benefit women as well as men, and Kathy and I were extremely interested, so we invited Dr. Rhee on the show. We definitely want to know what all of this is. Welcome, Dr. Rhee. Thank you for being with us.
Thank you very much. I really appreciate this opportunity to talk to you and your audience.
Yeah, this is great.
Yes, absolutely. Oh my gosh, Dr. Rhee, you are an extraordinaire in the field of regenerative medicine, and you cover a lot of areas. If you could maybe give us a brief background about yourself and what drew you to these therapies that I personally have never heard of.
So I started off, I'm a sports chiropractor. So I started off at UCLA and working with those top elite collegiate athletes. And as they evolve into professional type of athletes, you see their off-season training and on-season training, and you see how they recuperate or how they protect themselves for like prehab stuff. So as you see these athletes go into that world of preventative and just really how to really take care of themselves, you get introduced into this regenerative world. So I was first involved with this regenerative world back in 2007, 6, around there. And prototherapy was the current stuff that was out there, which is basically they inject, like if you have like an injury in your elbow, they'll inject this saline / sugar water into your body, into that damaged area, and your body will act as if that's like an antigen. It'll create like an antibody and creates like scar tissue or rebuilding material. Mm-hmm. So that's a prototherapy world. Then it evolved to what they call the PRP. We heard of that. And then now it goes into the world of stem cell, where they take it from your own body and they take out the thing called the mesenchymal stem cells, and then they inject that damaged tissue. And then now you get the tissue from a donor site from the umbilical cord called Wharton's jelly, and you take out the mesenchymal stem cells, and then you inject the damaged tissue again. And now it's into the world of topical application with the same donor site from the umbilical cord of Wharton's jelly. And it's a topical application that has a transdermal agent and pulls this through the 3 layers of skin into the damaged tissue. So now you don't have that kind of like that risk factor of like injections, right? For infection, downtime, a compromised tissue you may damage, and more importantly, the cost. So that's the world that I got into here.
Pretty amazing stuff. And anytime you have injections and so forth, well, I would imagine with stem cell injections, does it really stay at the injection site, or does it affect the entire body?
Yeah, so there's a primary and a secondary, right? So you when you inject or when you apply any type of regenerative properties in the area. There are vessels there that it will actually get into the vessels of venous or the arterial flow, and they'll systemically go through the body, in addition to target the existing tissue that you're trying to heal. So yeah, it does kind of both.
And stem cell injections, gosh, they're pretty expensive. I mean, you can spend thousands and thousands of dollars, right?
Yeah. I mean, I think the going rate now is between $4,500 to $15,000 per injection site.
Oh my goodness.
Yeah, it's very expensive.
Ooh.
Because, I mean,
Wow.
you think about the expenses of the actual, the material itself, is costly. Then you talk about the actual provider, and then you have to have a safe room, and then you have to do a lot of prep. And then it's just, one after the other, like expenses you have to apply onto that expense. Whereas if you do RheeGen, it's just a topical application that you can apply at home.
And what is the typical expense associated with the topical therapy?
Yeah, so typical retail price of RheeGen is approximately $1,000. So,
Oh, that's a big difference.
oh yeah.
Yeah. Now, if somebody wanted to have whole body benefits, would they have to apply that everywhere, or how would that work with a topical stem
So
cell?
so I'm a sports med guy, so I stay specifically to an injured site. But now the current procedure for a systemic protocol for, let's say you're dealing with, maybe they want to try to treat like a systemic issue you may have, like maybe an autoimmune issue or some type of maybe an anti-aging protocol. They'll do like an IV injection diluted with saline, and then it will get injected to your venous system. And then the neat thing about this is that there's different kind of vehicles for the systemic world. So mine is just localized with some maybe some secondary that'll go to the systemic system, but where you see like the whole body kind of application, you'll do the IV. So there's another process out there that's coming up right now. It's called a nasal spray. You can basically insert the applicator through your nose and inhale it. So the reason why they do that is because no matter if you're taking either the nasal or the IV, when it goes to your system, it collects in your lungs for 24 to 48 hours. So it sits there. Then after that, it starts actually like going back into the system and, taking care of all the cells.
Interesting. Okay. Well, I know that they've done vaccines. They've looked at the nasal application for those, right?
Yes. Yep.
Mm-hmm.
Yeah. Remember, so the tough thing when you do a nasal spray, if you have asthma, those are the things you have to be concerned about if you do a nasal spray, because they may irritate the capillaries in your lungs. So do you want to take the other option, which is the IV? Again, talk to your provider and then find out the best pathway for that systemic treatment protocol.
For those who may not be familiar, what do stem cells do for us?
Okay, so stem cell is kind of unique in its definition. Like stem cell is, what it does is it's like the root, it's like the starter of all your cells. It helps you make other cells, and it's like it kind of creates like a template or a beginning site to start up and work, right? So we have like all types of stem cells, from embryonic stem cells to adult stem cells to mesenchymal stem cells. There's all kinds of stem cells out there, and some of these are defined by its use, right? So you look at, like, they call a totipotent stem cell, where it can make a lot of other stem cells. Then we look at the things called a potent pluripotent stem cell, where you have a limited amount of like cells they can go into, and then you got a uni stem cell when it turns into one cell only. So it varies, but basically it's like the Kickstarter or the starting template for your body to reproduce or regenerate.
It never ceases to amaze me how the miracle of the human body it is. Like, it's just unbelievable how the depth of, of how we function, and we take it for granted. We don't even realize, you don't care. But when you start listening to someone like yourself, it's like, wow, like, holy man. And yeah, what you're doing is absolutely phenomenal. And I have one question. Going back to your topical cream, would that help? Like, my daughter has really bad plantar fasciitis. Would that help with that topical cream?
Yeah. Yeah. Perfect. Yeah. Perfect example. So plantar fasciitis is that fascia on the bottom part of your foot. So when you have like these little muscles in the bottom of your feet, these intrinsic muscles that help your foot kind of like, move, and they call it like a plantar flexion kind of a motion. You start the like, how would you say, like, stop using the muscle and depending on other structures like the fascia. And when you don't have strong muscles, it depends on keeping your foot or your arch, up. It compromises the fascia. So when you start compromising the fascia, you get these micro traumas. When you get these micro trauma in your fascia, well, the first thing when you hear trauma is the inflammatory world. That's where you hear the word itis, right? So then once you start getting the inflammation in the area, now you're having the cascade of more occupying like fluid inflammation in addition to micro trauma. And that's why you have that pain sensitive part of the foot right at the arch and close to the forefoot. So RheeGen will help quickly generate. So the thing with RheeGen and then regenerative medicine, the most important thing is that you're trying to see how you can be young again. And that tissue damage, and when you're younger, heals faster. But when you get older, we can't heal faster as if we were like in our 20s or teens. So we're looking for a faster pattern of healing, because when you look at the fascia of the foot, you're constantly walking, you're constantly using it. So if I heal faster, then I can get to walk up the next day and be able to walk. But because we're aged, we're having to have more time to recover, like 2 or 3 days. And then if you keep on doing more trauma over and over walking, well, you beat up that area and you're making that little micro trauma into almost a macro trauma where you're getting more of the fascia involved with it. So that's what regenerative medicine is. And when you look at someone like the 40 plus, you just want to quickly regenerate ourselves back to normal. Because it's all about, when you work out, when you do any type of movement, you do like a little micro trauma and you give yourself some time to rest and it regenerates, and then you're back to square one again. When you have a constant abuse, like walking or something like that, well, it's hard to rest it when you're actually using it. So we need a faster recovery, and that is used by this stem cell regenerative medicine.
Oh,
So the stem cell therapy, does it return the area that it's treating to a much younger state?
Pretty much, not so much a younger state. It just helps you recover faster. For instance, if you have a cut on your skin, like on a distal area, like down in the shins. Well, when we were younger, that thing would heal within a week or two. As we get older, it takes weeks and weeks, poor circulation. We don't have those growth factors. We just have a lot of our cells that were able to heal faster. Well, we're starting to limit our cells to recover or regenerate. So that's why you need something that has the ability to take that tissue that's probably dormant, wake it up, and then regenerate faster.
That would be a godsend for so many people, because chronic pain seems to be a pandemic today. I mean, everybody seems to have issues with all of that. Just watch any of the commercials out there.
You know what I feel, that the rise of that chronic pain, because everybody knows how important activity and exercise is after 40 years old. So exercise is a huge, how would you say, a preventative type of medicine or movement to avoid cardiovascular diseases, diabetes. The problem is that when you start doing an exercise, let's say you're doing a walk, an hour walk. Well, because of the repetitive movement, you'll start getting those injuries. Now, you will break down tissues of muscle and tendon, and our own body recycles and rebuilds. Well, as we age, we don't have those little adult stem cells or those little cells that can regenerate our damaged tissue to grow bigger, better, and stronger. So now we're in the repetitive movement of injury, microtrauma, where it becomes now a chronic situation. So either you rest for a long period of time to recover, or you speed up the healing process. And again, you go back into regenerative medicine.
Stay tuned for more of Women Road Warriors coming up.
Industry movement Trucking Moves America Forward is telling the story of the industry. Our safety champions, the women of trucking, independent contractors, the next generation of truckers, and more. Help us promote the best of our industry. Share your story and what you love about trucking. Share images of a moment you're proud of. And join us on social media. Learn more at truckingmovesamerica.com.
Welcome back to Women Road Warriors with Shelley Johnson and Kathy Tuccaro.
If you're enjoying this informative episode of Women Road Warriors, I wanted to mention Kathy and I explore all kinds of topics that will power you on the road to success. We feature a lot of expert interviews. Plus, we feature celebrities and women who've been trailblazers. Please check out our podcast at womenroadwarriors.com and click on our episodes page. We're also available wherever you listen to podcasts, on all the major podcast channels like Spotify, Apple, YouTube, Amazon Music, Audible, you name it. Check us out and bookmark our podcast. Also, don't forget to follow us on social media. We're on Twitter, Facebook, Instagram, Pinterest, LinkedIn, YouTube, and other sites. And tell others about us. We want to help as many women as possible. You've probably heard all the buzz about stem cell therapy. But here's the twist. You don't need invasive injections to get the benefits. Dr. Tommy Rhee, a pioneer in regenerative medicine, has treated everyone from the Tampa Bay Buccaneers, the UCLA women's soccer team, to the U.S. Navy. And he's showing us how non-invasive topical stem cell therapy is reshaping healing and longevity. His new book, The Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy, explains why this breakthrough could change the way we recover and stay strong. Dr. Rhee created RheeGen, a topical stem cell therapy. Stick around. Dr. Rhee's here to tell us more about how everything works. Dr. Rhee, stem cell therapy makes a lot of sense in terms of injury and repetitive motion and things that people do every day. It's a way to increase and maintain mobility and to stay young. Actually, I can't help but wonder, with all the technology that we have, if people aren't going to be dealing with more of these needs earlier, because you've got incidents of what they call tech neck with teenagers.
Yeah,
Because
absolutely.
they're leaning forward, they're looking down all the time, they're texting, they're looking at their device. And that's not where we're supposed to have our necks.
No.
You know.
Yeah. Everything that comes to biomechanics, when you change your biomechanics because of, posture or that mechanical change in the chronic, you're going to stress out some ligaments. And then, the worst case scenario is when you actually get the formation of that, like that forward head movement. And then the worst scenario is that when you're stuck in that position. So absolutely, you need to correct that movement as much as possible. And when you get to that damaged component of those ligaments, well, you have to figure out how to heal that. So you want to just get either more rest to recover from that injury or speed up the healing process.
What about like I have a lot as a heavy equipment operator, we have a lot of shoulder injuries and and the healing. A lot of us are over 50.
Mhm.
And my one coworker had a shoulder replacement on both shoulders, and she was off for almost 3 years.
Yeah.
Now, to this day, she's limited in what she can do. Would RheeGen would that be assist her at all?
Yeah. So this was the wonderful thing about a topical regenerative medicine cream RheeGen. This is what's great about it. There's no downtime. You can continue your activity while applying RheeGen. So RheeGen is a 30-day application. And then we recommend, you can still do your activity because it was really meant for like professional athletes during the season. So when you think about like, an injection, let's say you do stem cell therapy prior to, you're doing surgery, right? So you want to do the most conservative approach. So back then it was injectables of this stem cell. So the reason why you have downtime because you have a primary injury site. Let's say it's like one of your rotator cuff muscles in your shoulder. Well, if you hit the area with a needle and you're going through tissue, well, you're compromising another spot. So now you have a primary and secondary injury spot. Now you're recovering from two sites, and that's why you need downtime for the secondary injecting sites. So now, because of lack of movement, you might, start getting into a little bit of more adhesion buildup, and then it kind of puts in a cascade like, it's just not faring that well because you're immobilizing that joint because you have to recover from the injury site of the needle. So, but with the topical, you want to continue on moving. You want to continue on doing your same activity, and that will penetrate through the skin to the damaged tissue over the 30-day period, and it yields as much as the injectables. Now, let me tell you why I moved into the topical world. So as my athletes are typically going through their season, one of the complaints they had, they couldn't do these stem cell therapy injections during the season because of the downtime. So when you have downtime with pro athletes, like missing weeks, well, you're playing with their money, right? So it's basically you miss a couple games, it's in their contract, you get paid per game or something. They don't want that. In addition to some other factors like contracts, or they don't want to report injuries. So what these guys would do, to avoid that kind of like that pain, they would do that pain med stuff. You heard about the injections and all that other things that prevent them to feel what's going on down there in their ankle, whatever problem they have. So with a topical application, I started thinking that's non-invasive. It can deliver the same information, the stem cells down into the tissue, and then continue play. So I had a quarterback that was going through a bad Achilles tendon. And he kept on, doing the off-season protocol, like with all athletes. They go through a stem cell injection protocol off-season because they don't have to work out or do anything. So they have the ability to do some rest time during that period. But during the season, this quarterback, his Achilles tendon wasn't healing correctly. So he came up to me, we talked about it, and we started doing RheeGen with him, that topical application. So he was the one that helped me tune up, formulate it, change the kind of the overall feeling of it. And because of him and him using RheeGen during the season, he was able to play the whole season, injury-free. It healed. And more importantly, since he was at the last year contract, it was not like a negotiating tool like, hey, I can't give you that much money because of, your injury here. So that helps him out in that world. So that's how it was first developed. And I started thinking, well, if it works for that top athlete doing that high velocity trauma, well, it definitely going to help out civilians. So that's why it went into this world. Then it went into things of like, the 40 plus that we have. We still want to be active. We still want to play pickleball activity at the later age, but we just need something to speed our healing process. So that's how it transitioned to that. So that's why I'm excited about RheeGen for the topical aspect, is that now you can have anybody use it without that invasive world and no downtime.
So it eliminates pain and increases mobility. That would be just a life changer for people.
Imagine that football player, if he didn't have that, the future would have not turned out the way it did, right?
No, especially, we still talk about it. He's still a diehard person. Football players they always go through injuries. So he goes, oh, I got this, I got that. He goes, okay. So yeah, absolutely. But what I love about RheeGen is that now, because, it's like, like sometimes when you think about medicine and you see where it's going down, and then I wouldn't say the trust value, but you always have to question. You want a second, third opinion. Well, the great thing about our technology, like we talked about, is that there's so much information out there, so much, places where you get like good data points, and then figure out what protocol maybe it fits for you, and maybe it doesn't, or maybe there's something unique out there. Well, it gives the patient the ability to start like really commanding of what is maybe a possibility that it's out of the doctor's hands. So that's what's fun about this, is that RheeGen or stem cell therapy is so new, but so proven out there that it's unique in its own world of like where to go with this. Where's the future seeing this? And then if you can actually have it in the patient's hand and then have an idea where this can be applied, well, that's where the topical world gets involved. Now it's in the patient's hand. Where I go, hey, I've got this elbow pain. It's tendinous elbow. I've been diagnosed. Let me apply it on here. And then, they have more of a control of the protocol and the treatment.
So the way this is designed, the molecules are small enough to penetrate all of the layers.
Yep.
Because I know that's been a challenge. The molecules have to be small enough.
Yeah. So there is an agent in the RheeGen formula that helps penetrate or, permeate through the 3-layer skin, and that is called DMSO. And we've all known about DMSO in the past. So that's the vehicle that we use to get those small molecules through the 3-layer skin.
For those who aren't familiar with DMSO, what is that?
So they call it dimethyl sulfoxide. It's a solvent. It's a natural solvent that comes from tree bark. It was discovered probably back in the early 1900s. And where I heard more about it is when I was younger, back in 1970s and stuff like that, you would have that unique smell with people like, what is that smell? And it was one of the sulfur components of the MSO that people with arthritis would rub on their knees or their elbows, and it would be fantastic for arthritis. But the interesting thing is, it's such a good transdermal application that when you apply it on your skin, right away you taste the sulfur and you smell it very fast through your body. So it penetrates very fast through your skin.
It's a lubricant. I have neck issues, and I actually have used DMSO in the past, so I'm familiar with it.
Really?
Uh-huh.
Did it work?
It did. I don't know why I quit using it, but I think I've tried a lot of different things, because certainly working at a computer all the time doesn't help the situation with my neck. I would imagine that RheeGen would really maybe alleviate some of the pain. Now, can it actually rejuvenate, say, discs that have been degenerated in your skeletal structure? Or?
Okay, so here's the thing with when it comes to like disc issue. It's deep in the actual like the low back or your neck area, and you have to penetrate through a lot of like tissue, like your muscle, fascia and stuff like that. So depending on the severity of your disc issue, if you have there's like certain grades of how bad things are. So, grade 1 is not as severe as grade 3. So when you look at something that not that severe, let's say you have a little bit of joint space loss because the disc has gone a little bit, in its age process. Now, RheeGen will help, but the thing is that just like if you were in an injectable role for stem cell, it may be one of those things that it's not going to be a one injection. It's maybe a whole year of like every 3-month injection. So it all depends on the severity of that disc. Mm-hmm. So just like, they do injection, we kind of compare that with RheeGen. So if you have a severe, like a grade 3 disc with like a DDD, like disc degenerative disease, then we would say if like you need like at least 3 protocol or 3 treatment or 3 kits of RheeGen throughout that year period to help that tissue generate.
Okay. So there is hope for people with degenerative disc disease, because that can come on at a very young age too.
Oh, now going back to that techno neck, absolutely. Our neck, low back, middle back, we have a curve, a natural curve, and they call it like either like a lordotic or a kyphotic. It's like if you look at yourself in sideways position, it looks like an S, right? Now, we always think that the discs are shock absorbers, but in actuality, it's for mobility. We want motion. So like our cervical have the 7 segments of the spine, and then lumbar has 5, and the middle of our back called thoracic have 12. Well, the disc in between like all these vertebrae bones, well, the disc, we look at that in our world as mobility. You want to keep the curve. So it acts as one big spring, just like a slinky, right? So when you think about walking, if you have a curve from your cervical, your neck, thoracic, your mid back, and your lumbar, low back, and you're doing any kind of compression in your body by walking, it springs back and forth, not disc by disc, but the mobility of all the segments act as one spring. But when you have like a straight neck or a straight lumbar and you lose the curve, well, now you're playing havoc on the disc where the disc starts bulging out, herniating out, and you don't want that. You want to keep that natural curve. So posture, very important. That techno neck you said, that's not good, because then you have that straight neck, and then all of a sudden the disc starts invasively going outwards, bulging and then herniating out. And then now you're going down that cascade of like bulging, herniation, then you go to neuropathy, and then all the orthos in that world say, all right, you need a discectomy, latomectomy to alleviate the nerve pain. Then you go down the cascade of and now you're going down the rehab world. So yeah, you see how everything starts with number 1, poor posture, and then number 2, your biomechanics, and how to correct and get somebody to identify that. So RheeGen has the ability to regenerate, but when it comes to posture, that's a whole mechanism of self-discipline there. So you all understand that part.
So my mother was correct when she said, sit up straight.
Oh, 100%.
Stay tuned for more of Women Road Warriors coming up.
Industry movement Trucking Moves America Forward is telling the story of the industry. Our safety champions, the women of trucking, independent contractors, the next generation of truckers, and more. Help us promote the best of our industry. Share your story and what you love about trucking. Share images of a moment you're proud of. And join us on social media. Learn more at truckingmovesamerica.com.
Welcome back to Women Road Warriors with Shelley Johnson and Kathy Tuccaro.
Let's talk about one of the hottest topics in health today, stem cell therapy. Most people think it means needles and expensive, invasive procedures, but Dr. Tommy Rhee is changing all of that. He's a pioneer in regenerative medicine who's worked with the Tampa Bay Buccaneers, UCLA athletes, and even the U.S. Navy. His new book, The Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy, reveals how non-invasive topical applications like his own creation, RheeGen, are helping athletes and everyday people heal faster, stay mobile longer, and boost their quality of life with no downtime. Stay tuned. Dr. Rhee is explaining how all of this works. It's really fascinating. Dr. Rhee, in our last segment, we mentioned posture as being super important. So self-discipline's part of keeping our mobility, along with the advantages of stem cell therapy like you have.
Here's something funny about, you always hear females are more prone to like neck herniations than males. I think one of the common threads that's really like pronounced is hair, because majority of females have longer hair than males. So when you think about hair, you think about, the weight of the hair, and then you apply water to that hair. You're maybe like almost a half a pound to a pound of extra weight you're applying on that neck area with the hair. So that's another thing that you have to be cognizant of, like how to keep that posture. Because if you have the good posture, you can handle that weight, the extra weight of that hair and being wet. But if you're out of position, that extra pressure, well, it's applied to your discs now. So that's why it'll go down that pathway.
Makes sense. You don't think about how heavy hair is, especially when you
Oh,
watch
it's
it.
heavy. Yeah, people have. My cousin, oh my God, she had hair down to her bottom, and it was so thick and heavy, and it was just it gave her a headache. She ended up having to cut it because it was just too much.
Yeah. It's nice when you're younger, but when you get older, you know how that goes. Especially when the hair gets wet, then you're looking at, whoa, that's a lot of weight.
It's a lot of work.
Yeah.
I think as women get busier in their adult lives, they're like, I don't want to deal with this all the time, unless you have a hairdresser that you can take with you. And most people don't. Dr. Rhee, you also have been involved with oxygen therapy, WholeBody Cryotherapy, PiezoWave, Shockwave therapy. What are all those things?
So because of injured athletes, you want to speed up the healing process, and that besides regenerative medicine, that includes oxygen. So when you look at oxygen in its form, you want to include it into like the healing process, right? So just like if you have like a cut, how you have a cut in your hand, you let the air out, it heal faster. Well, that's the same principle. You want more oxygen, you want more the healing properties to the damaged tissue. So we have things like, a hyperbaric chamber. It has higher pressure, so it can diffuse to the cell membrane to get to that cell to heal faster. And then there's another thing called the EWOT, which is like exercise with oxygen therapy. So the hyperbaric chamber does more of a passive, from the gradient being stronger outside than inside the cell membrane. So the oxygen molecule is pushed through the membrane going to the cell. With EWOT, it's almost the opposite, draws it in, because you're basically doing a high intense exercise for about 8 to 10 minutes, and you're breathing like 60 pounds of oxygen, and it's forced into your body. So you're pulling it in because you're at extreme exercise, that you're pushing your lactic threshold higher. So it gives you the ability to go harder, stronger, because the O2 is consumed at a faster rate. So again, that's another way of pulling oxygen through your body. Instead of being forced into it, it's getting drawn into it. Then I have another device that's called a PiezoWave, and then they call it the old AKA the Shockwave or something like that. So it's just basically there's fluid that gets caught in between joint space. So I can't manually get between, like, let's say the top part of your ankle, they call it the talar dome. You can't get in there to flush out that fluid. So you need something forcefully to get out there. So we use this high velocity sound wave and the PiezoWave to get in there and push that fluid. And it just focalized right into that joint space, and it pushes that fluid out. So it gives you like more of a fluidity in that joint, so that it won't have that compression of the excess fluid and inflammation. So, when you're in the sports world, you want the latest and highest technology you can find out there to help these athletes or civilians or anybody that have to do with movement. You know, our mission statement here is we treat everybody like a pro athlete. So that includes, weekend warriors, the people that sit in the office, we treat them all like an athlete. We always look at you as a moving object. If it's high performance or low performance, you're still moving. So when we look at that, then we say, all right, what's the best equipment for those pro athletes or people behind the desk? That's the equipment. So we look for those type of equipments to help you heal faster and really just get you back to play or, whatever you're thinking about doing.
Makes sense. Well, I imagine people, when they're weekend warriors, do some serious damage. If they've been sitting all week and then they decide to really break it loose, they come back hobbling and hunched over on Monday.
Yeah. Hey, you know how the old what's the old analogy? I'm young in mind, not in the body. That's the problem with all of us. We all think we can still do things like we're 20 years old.
Sure. But mindset really is a positive thing.
Oh, absolutely.
Wow.
That absolutely is a very positive thing. It's just that you just need a body to catch up to the mind. You show some activity.
Yeah.
But I've known people in their 20s who think old.
Yeah.
And they're setting themselves up. So
Yeah. I always see that the biggest component of majority of these you hear the classic disorders or diseases that are coming up more often, like diabetes and cardiovascular disease. One of the components that are missing is just the simple movement, exercise. You got to keep moving. Your body loves that stress.
Yep.
And then you just kind of just put yourself in a little bit of stressful situations so you can handle it as you go further in life.
We are more sedentary as a society than we were 50 years ago, when you think about it. It's good to see children when they're running around outside, when the parents say, get out there, because most of them are in front of their video games or their smartphones. They're sitting.
Yeah, it's incredible what's going on out there. You hear about even the curriculum in school are restricting PE classes, and they're shortening a lot of these activities to be physical in class. So yeah, it's interesting where it's evolving, right?
It's not evolving correctly. I mean, we're not designed to sit.
No.
And I know as a kid, I could not sit. It's like, I'm done with my work. I'm going to run around the room. It's like, Shelley, sit down. Now, whole body cryotherapy, is that the same thing like the cryogenics? I mean, what is that?
So whole body cryotherapy. So you're basically in this chamber for about 2.5 minutes at below 166 degrees. And the object is that, you want to do what they call a sympathetic reaction, where you shunt all the blood from your extremities to your core and you vasoconstrict. So the therapy itself is not during the actual cryo aspect of it. You heard like the cold plunge and all that. And it's the same theory, but in this case, it's a lot faster. Because the first thing your body does in the physiology world, it's when it feels cold, it wants to warm the area up. So it does what they call vasodilation. So it brings more blood flow to the area. So your capillaries open up and it allows more of the oxygenated blood with that core temperature to get to the extremity, the arm or leg. And then it tries to warm it up. When it identifies that it can't warm up, then it does the opposite, which is basically close the vessels down, protect the core of the heart and organs, and shunt all the blood from the arms and legs to the actual core of the body.
Right.
So with whole body cryotherapy, it's so cold that it bypasses the first component of it and it goes right into vasoconstriction. It goes right into the sympathetic reaction. So what the idea is that it's not so much that you don't want the cryo component of it. You want the secondary, the result of the sympathetic is the parasympathetic. When you come out now, the body recognizes we're back to a room temperature. So it goes back to the parasympathetic and it vasodilates large vessels on all the vessels and it opens things up. So then you can quickly flush out. So now you have oxygenated blood going down in this large diameter of the dilation, but also the venous and arterial flow are opened up. So now you're flushing out all that extra stuff, including metabolic waste. So when you
Okay.
have that kind of inflammatory world, you're stuck with like a long period, like, you always feel like a little swollen or some type of inflammation or something. Well, that's what the idea is, that you want to flush it out fast. So that's why you go into the cryo. And then when you come out of it, 5-10 minutes later, you feel that flushing feeling of that warmth through your whole body. Well, that's the body returning it to its normal function. So WholeBody Cryotherapy was first developed by a Japanese rheumatologist that was working with rheumatoid arthritis. So that was one of his protocol, because, rheumatoid arthritis is basically your body autoimmune. It's trying to, fight itself or attack itself. So when it comes to RA, rheumatoid arthritis, some of the things that you want to get out is that metabolic waste. So this Japanese doctor went into this world of cryotherapy, and he saw great results about pain and getting back to, like, normal function. So that's how it was first started. And then athletes took upon it to recover faster. You want to get that metabolic waste, all that, like that excess bad tissue, you want to get it out, that all the free radicals, you want to get it out. And then it moved into the world of just wellness. So cryo. So when you hear about when people, and they do like cold plunge, that's why they want you to stay in there a little longer, because your first couple minutes is a warming sensation. And then secondary is the constricting component of it. So that's the WholeBody cryotherapy.
So you're flushing the body of toxins.
Yeah. Afterwards, not during the time, afterwards.
Mm-hmm.
So you want the aftermath of that cryotherapy.
Stay tuned for more of Women Road Warriors coming up.
Industry movement Trucking Moves America Forward is telling the story of the industry. Our safety champions, the women of trucking, independent contractors, the next generation of truckers, and more. Help us promote the best of our industry. Share your story and what you love about trucking. Share images of a moment you're proud of. And join us on social media. Learn more at truckingmovesamerica.com.
Welcome back to Women Road Warriors with Shelley Johnson and Kathy Tuccaro.
Stem cell therapy's everywhere in the headlines. But what if you could get the benefits without the needles? Dr. Tommy Rhee has been leading the charge in regenerative medicine. He's worked with the Tampa Bay Buccaneers, UCLA athletes, and even the U.S. Navy. His therapies are unique. In his new book, The Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy, he reveals how his innovation RheeGen is making healing faster, mobility lasting longer, and life better, all without invasive procedures. He's changing the face of what getting older means. Dr. Rhee's been sharing his great insight with Kathy and me. Dr. Rhee? I would imagine with all of the different chemicals in our world today, there's a lot more toxicity that maybe people 60, 70 years ago didn't deal with.
Oh, yeah. I think the prime example I still use, I remember back in the 70s, a loaf of bread couldn't stay longer than a week. And now you can keep a loaf of bread for 3 weeks on a shelf.
It's kind of scary. It's like,
Very scary.
yeah.
What's next? I mean, there are things out there that we don't even know. We see, look at the ingredients, look at that, go, what is all this stuff here? I think the best, if you really want to know what goes on as far as is it safe for you, just put a food down on the ground and see what insect or ants or something will eat it. If you see it's still there and nobody's touched it, it tells you exactly what that's about.
It's kind of funny because I have a severe gluten allergy, and at work I'll toss out the gluten-free bread. Even the ravens won't touch it. Even the gluten-free crackers, they won't touch it. Yeah, it's kind of funny. Anything but the gluten-free.
If insects aren't going to eat some of that stuff, yeah.
Why would I?
Yeah, because they're nature's cleanup crew.
Yeah.
When you think about it.
So you remember when margarine was around?
Margarine, oh yeah.
Do you remember it would never melt? Just never melt. You stick it out in room temperature and never melt. Whereas butter, we had butter. I mean, it would basically be almost back to liquid. Yeah. And I remember ants and roaches around my house. I used to live in a bad part of town, but they would never touch that stuff. They would just, you can see them attack everything else like butter and stuff, but not that.
Yeah, we need to do some thinking And do some observing what Mother Nature's consuming. And if they won't touch what we're eating, maybe we shouldn't too. Yeah, good point.
Uh,
So, Dr. Rhee, where do people find your product? Where do they find your book? Your book really is a great tutorial for people. I think that there are a lot of different things that you cover, the types of stem cells, cell damage and aging, who's a candidate for stem cell therapy. You explain chromosomes and telomeres and telomerase and all of that stuff. Those are kind of the building blocks, aren't they, with our bodies? Where do people get educated with the future of regenerative medicine, unlocking the potential of topical stem cell therapy, and where do they reach out to you?
okay. Well, as far as my book, you can go onto Amazon and just you can type in my name, Dr. Thomas Rhee, or you can just do the title, which is the Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy. And again, yeah, exactly. So it has the science aspect of it, and also has a layman's terminology in there, so we can all follow along the path of Jeff and his quest of understanding about stem cell and topical stem cell. For RheeGen, you can look up rheegen.com, which is RheeGen.com. And there's a lot of information on there and a lot of good topics. And then if you have any questions, we have the social media sites that goes into any type of like scenarios of a particular injury or something. And if you need to get a hold of me, there should be a little link there that you can go info@RheeGen. Just ask me a question and I'll shoot back to you within a couple of hours or days, depending on where I'm at. And then I'll get your answers.
Excellent. Well, I would imagine people have different needs and maybe even reach out to you regarding just anti-aging. Certainly, women we're always being programmed. You've got to look like you're 16 years old,
Yeah. Yeah. It doesn't just stop there. I think everybody wants to be 16 years old. I looked at my old pictures and, oh, look at those days in the Navy. Look at that.
Yeah. What's the perfect age? If people could go back in time with the knowledge we have,
Yeah.
what would you want to look like and feel like? And wouldn't it be really great? I mean, do you see that with stem cell therapy, that it's going to essentially prolong our lives, but also the quality of life?
Yeah. So there's like two age spans. There's our age, there's a lifespan and an active lifespan. And I know that people want to think about the aesthetics and how you look, but I always look at how you feel. That's really important. How can you keep going forward? Exercise, being active, because activity and exercise is such a good a mental, how would you say, almost like a therapeutic way of dealing with other type of mental stress, the physical aspect. So where I see in the future is that aesthetically, it would definitely go there, but it's about the physical side of it, about allowing yourself to keep going, keep allowing yourself to play that pickleball, play with your grandkids, be able to keep moving so you're functioning fine, and then you're having that fun feeling of being active as if you're young.
That's what life's about. If we don't have quality of life, there really isn't life. You want to be able to participate in life.
Oh, yeah. That's the biggest thing to do. I always say that if you look at, but that's what the beauty of my office is. I get to see all ages in their injury and what set them off into that cascade. So I'm fortunate to see the future about my life and others with the examples of my patients here. So it's one of the key components is activity. When you see someone in their 90s, 80s, still active, and one of the key components, exercise, keep moving,
I was nursing for 13 years and I worked 4 years in orthopedics, and we had the top hip replacement in the country, in Canada, and knee surgery. And the thing that was the most noticeable was those that exercised versus those that didn't in their recovery. The ones that constantly exercised, done yoga, the healing process was almost immediate, as opposed to those who never walked, who never did stairs. It would take the length and time for healing was almost double. Big difference.
Yeah. And that's why I always think about active lifespan, being in an 80s, still being active. You always want to think that I want the ability to continue walking and being competitive in walking, just like as if you're in 20s. I can only imagine what it feels like if I'm in my 70s, that have a difficult time walking just a quarter mile. I mean, that would be mental, like detriment to my whole psychological outlook if I can't apply that kind of like physical stress on my body.
Sure. Yeah, we don't feel good. It affects our mental state. It's everything. And people deteriorate. They get depressed. They get discouraged. It's just a whole body reaction when you think about it. So, Dr. Rhee, what is your website again?
It's www.RheeGen, RheeGen.com. And then again, Amazon, if you look at the Future of Regenerative Medicine at Amazon, and you can see my book there.
This has been super informative.
So interesting. Oh my goodness. So interesting. Thank you very much.
Yeah.
Oh, you guys are great. This is so much fun. I loved it.
Well, thank you, Dr. Rhee. We appreciate it very much. And this has been informative for our listeners.
Yeah,
Great.
you guys are great. Awesome.
We appreciate having you on the show, Dr. Rhee. Thanks so much. And both Kathy and I have learned a ton. It's been a pleasure. We hope you've enjoyed this latest episode. And if you want to hear more episodes of Women Road Warriors or learn more about our show, be sure to check out womenroadwarriors.com. And please follow us on social media. And don't forget to subscribe to our podcast. On our website, we also have a selection of podcasts just for women. There are a series of podcasts from different podcasters. So if you're in the mood for women's podcasts, just click the Power Network tab on womenroadwarriors.com. You'll have a variety of shows to listen to anytime you want to. Podcasts made for women. Women Road Warriors is on all the major podcast channels like Apple, Spotify, Amazon, Audible, YouTube, and others. Check us out. And please follow us wherever you listen to podcasts. Thanks for listening.
You've been listening to Women Road Warriors with Shelley Johnson and Kathy Tuccaro. If you want to be a guest on the show or have a topic or feedback, email us at sjohnson@womenroadwarriors.com.